Well, I'm going to talk about growth hormone deficiency in adults. Well, growth hormone deficiency, hormone deficiency is based on the hormone growth hormone, as you may call, also known as HGH, and it's produced by the pituitary gland. It supports growth in children and adolescents, helps to regulate body composition, body fluids, muscle, bone growth, sugar and fat metabolisms, and possibly heart function. Now, for application in medicine, we have to know about the main illness that is the growth hormone deficiency known as GHD, also known as dwarfism or pituitary dwarfism, is a condition caused by insufficient amounts of growth hormone in the body. Now, for pros and cons, we're going to talk about the diagnosis of this GHD. A physical exam and measurement of height, weight, arms, and leg length are the first steps to diagnosis, in addition to through medical history. Blood tests to measure the levels of growth hormone in the body, as well as the level of other hormones. For the pros, we have to talk about tools of the diagnosis of GHD include auxology, radiographic assessment of bone age, measurement of insulin-like growth factor 1, known as IGF-1, and the IGF-1 binding protein 3 or IGF-BP3. The results of provocative GH testing are dependent on the assay used, the pubertal nutritional status of the child, and the GH secretion pattern. Prior to testing, these tests are poorly reproducible. Now, in the cons, the diagnosis that abnormal findings on pituitary MRI indicate our relative likelihood that GHD will persist into adulthood, and main subsequent pituitary deficiencies may develop. Children with IGHD and family history of GHD should have GH1 and GHR mutations. Other genetics is not yet applicable in this diagnosis of GHD, but not contribute to the illness in the future. Now, for the issue playing where we have the short stature occurring by definition in 2.5% of children is a common reason for pediatric endocrine evaluation for cases in which other diagnoses include genetic short stature, constitutional delay of growth, and puberty hypothyroidism, Turner syndrome, and chronic disease such as celiac disease are excluded. The question of growth hormone deficiency inevitably arises. The prevalence of GHD is estimated at approximately 1 per 4,000 to 1 per 10,000. Now, in conclusion, we have to talk that the diagnosis of GHD remains difficult, and recent literature largely serves to reiterate the unsatisfactory nature of our current diagnosis process. Literature continues to highlight the flaws in provocative GH testing, and such testing must be carefully interpreted in light of assay issues, lack of reproducibility, variability according to type of the stimulus, body composition, and pubertal status.